Could an insurance company come between you and your patient? Step therapy is a tool used by insurers that sets which treatments the insurer will cover and in what order. Insurers using step therapy often mandate which treatments are tried first before the provider-recommended treatment is covered. In gastroenterology, step therapy mainly affects patients with IBD, inflammatory bowel disease. Let's take a look at how that may affect you and your patients. Let's say that for one of your patients with IBD, you have decided to prescribe a specific treatment regimen. So, you and your staff fill out the forms for the patient's insurance coverage. And that's when it happens. The insurance company says no, and it imposes its requirement for step therapy. This means the insurance company dictates that for your patient's condition, you must first try a different medication for a certain amount of time to see if it is effective. There may even be a sequence of therapies you must try, one after the other, step by step. Hence the name step therapy. Step therapy is intended by insurers to minimize both the costs and the risks of using certain medications. The idea is that more cost-effective drugs should be tried first, ones that have proven effective with other patients with the same condition. But insurance companies even vary from each other on exactly which medications they require. The concern is, your patient's condition may be quickly deteriorating as treatment after treatment is given a trial. This interference with your ability to prescribe what you believe is the best treatment for your patient may threaten the doctor-patient relationship. Not to mention the chaos that may come if a patient switches health plans and has to experience all of this again. By the time you step your patient through all the therapies required by the insurance company and can finally move to the therapy you prescribed from the beginning, the patient's condition may have become much worse. And because the condition is worse, the original prescription may not even work. New state laws may help. You may have the right to request an exception to the insurance company's step therapy requirement. And if they deny that request, you may have the right to file an appeal. To make sure you can protect your patients, here's what you'll need to learn. 1. Does your state have a step therapy law? 2. Who is eligible for protection under the law? 3. What are the key protections? And 4. How do you request an exception to step therapy requirements? Learn more about specific state laws and what AGA is doing to advocate for step therapy laws at the federal level by visiting the AGA website.